Very good evening, one and all present here. I welcome each one of you on behalf of the Department of Psychology, American College, Madurai, and all the associating institutions like Madras School of Social Work, Chennai, M.H. Chelamurthy Institute, Madurai, and the different associations like Tamil Nadu Career Counselors Association, Tamil Nadu Counselors and Psychotherapists Association. I welcome today's speaker and the renowned person in the field of holistic wellness, and she's having that curricula at Coimbatore. Mrs. Sasi Chandran is an CEO of Nitya Gurukula, and she's having many credit for her academic component. For example, MA in psychology, MBA in marketing, and teaching supervision on transactional analysis, and CT and counseling. And she's a certified instructor for the preventive medicine for Tai Chi by using the Tai Chi. And she's an as per my understanding, there are many inputs I received from some of the participants who had attended here. And she's a visiting faculty and guest faculty for different institutions in and around India. And she's having a lot of experience in that the field, and she's expertised in training and incorporating that Indian system of values, and holistic wellness are the primary area I just mentioned. When I go through the profile, it goes long, and it takes the time another 10 minutes to explain that, introduce the speaker over here. And I will upload that link of the today's speaker's profile in our chat box immediately after she's taking. And you can go through the profile and you can know that, yes, she's a person who, having a lot of experience and expertise on different modalities. That's why she's the right person to talk about the holistic wellness. I think we are facing the pandemic crisis, not only the particular section of people, almost all the section of people who are having a certain kind of problem. And during this time, we have to give priority to that. Instead of focusing on the illness, we have to focus on the holistic wellness. And that need to be inculcated, and that need to be imparted among the population. And today's session, I hope, I understand that this is a stepping stone, a milestone for the field of wellness and health component. And I'm really happy to welcome you, ma'am, for today's webinar session. We are eagerly waiting here to listen from you without any time taken from my side, and I give a space to you. You can take over the session. Welcome. Over to you, ma'am. Can you please unmute your audio, ma'am?
Yes.
Yes.
I do this mistake, not unmuting very often. Thanks for reminding me. Thank you. And I've met students from the American College, Madurai, in different forums. I'm a research scholar in the University of Madras, so that's attended quite a few seminars over the last 4 years, and I've met quite a few of your students. So it's a pleasure, it's an honor and a privilege to be part of today's program, webinar. One request, as many of you whose bandwidth allows, please switch on your videos if your bandwidth allows, so I know who I'm talking to. But I understand if you don't switch on also. So yes, very briefly, I will introduce myself and why I wanted to talk on wellness. I started my work 40 years back in an interreligious center called Divyodaya in Coimbatore as a freelance counselor for women and students largely, and children. As Dr. Suresh said, the focus was on wellness right from the beginning, because I got into the field of psychology to enhance my wellness so many years back. There's a person from Vivekananda Institute, Kanyakumari, who spoke to us about transactional analysis. And that's when my journey started. I'm going to stop my address and just make one announcement. I will be talking largely in English because we have people from different parts of India. So if I mix it with Tamil and talk, I think they will have difficulty. So உங்களுக்கு யாருக்காவது புரியலன்னா தமிழ்ல இல்ல நான் தமிழ் ஏதாவது டிரான்ஸ்லேஷன் வேணா just give a message in the chat boxல போடுங்க. my colleagues who are present, இங்க இருக்கிறவங்க இன்டர்பிரேட் பண்ணி எனக்கு அனுப்புனா நான் அதை தமிழாக்கம் பண்ணி சொல்றேன். இல்ல இந்தியால பல பகுதிகளில் இதுல இருந்து அட்டென்ட் பண்றதுனால தமிழ்ல பேசுறது வந்து அவ்வளவு பொருத்தமா இருக்காதுன்னு நினைக்கிறேன். So please excuse. So I'm going to switch on to English. So I started my career counseling women and children, and then I happened to work in the cancer wards for about 12 years. And my work was supportive cancer care. And one young woman who was about 18 told us, "I'm happy I got cancer because we met people like you and we are looking at the world differently." So even in such illness, I found there could be wellness. There were, there's an echo coming.
Yes.
Is there some way we can handle it?
Now there won't be any call.
Thank you.
Yes, sir. Still it is going.
Yeah. The echo? No. கொஞ்சம் இருக்குங்க, but I'll manage. So coming to wellness, I've seen in the midst of pain, in the midst of suffering in the cancer wards. I'm going to give you a case study sometime later. I've seen wellness, holistic wellness, all age groups. We are talking about from 3 years to 80, 85 years we worked with. Now this pandemic is gripping all of us. Usually I'm not very scared of infections because I believe with my Tai Chi practice and yoga practice, touch wood, my immunity is higher in an anikiran. I rarely get a cold. I used to get very often allergies and colds. But the second wave got a tight grip on me because one of our members of our institute, Nitya Gurukula, got COVID. The whole family suffered. So, and closer it came, the people where I live on the street. So it sort of gripped me more than a personal pain. The suffering of our people hit me. And some of the webinars with my colleagues abroad, I saw them suffering. I see them suffering for economic reasons, literally depressed and low. So it has moved me very, very, very deeply. And in a way, it's a moving where I also feel a global connection with people all over the world, which I didn't feel so intensely and so deeply till now. So today, my plan for today is, I'm going to share a PowerPoint. Can all of you see the slide? Yeah, visible? Good.
Yes.
So, today is a journey and exploration of the realities of the pandemic, what it is doing to us individually and collectively, what are possibilities, are there possibilities, and finally, holistic wellness probability we are going to look at. So let us begin with the effect of the pandemic. I'm sure as psychologists, all of us here are psychologists, even those who do not have a degree, because I think from the beginning we start analyzing human behavior, human thinking, etc., whether we are a formal psychologist or not. So I think we can go deeper into the effect of the pandemic. Physically, there's pain, there's suffering, there's death and loss. And when we talk of loss, there's loss. The most severe loss is the loss of life, loss of income, loss of jobs, loss of relationships. I mean, loss is the underlying theme. And the result is uncertainty. Nothing is sure now. Once a month, I used to travel to Chennai, enjoyed my trips to the university, sit in the libraries, and spend time with my guide and my fellow research scholars. Now I don't know when I'll be able to go. There's chaos, there's confusion, there's numbness, there's panic, there's regression, we go back in age. So then, in this reality, what are the possibilities? One of my colleagues in ICTA, Institute of Counseling and Transactional Analysis, Kalamaseri, he spoke to me, or he made me speak on new normal to next normal. It was a new topic for me. What is this new normal? When I'm hesitant to step out of my home, when I'm scared to talk to another without a mask, when I cannot be the free bird I was, driving around, walking around. Now that is the new normal. When I have to think, when social distancing is essential. So what will the next normal be? We don't know. So in this situation, are there possibilities? And my answer is a lot, many possibilities. And I'm not saying it to convince you. This is my experience. Last year during the lockdown in Nittigurukla, we shut down for 2 months meeting each other. But I found that we were very active online. We worked overtime. But this year, the number of COVID counselings have increased for Nittigurukla. The number of training sessions, webinars, etc., have become 3 times or more. So we get a lot of images for wellness. But I'm going to give you 2 case studies. One that happened many years back, maybe 20 years back or so, when I was working in the cancer ward. And 1 minute, how do I stop sharing? I'm just looking at the slides. Just give me a minute. Yeah, thanks for that rescue package, whoever did that. We can stop. Yeah, good to see your faces. Yeah. So I went to Malaysia to attend a cancer conference. And then I wanted, it was on hospice, mobile hospice, the conference. So I was there, and my Malaysian counterpart, then I was a counselor, running a cancer counseling center. She took me to a hospice where there was a woman from Tamil Nadu. She was an inmate of the hospice. I remember her name, Tamil Arasi. And in every way, she was Tamil Arasi, translated into English means queen, Tamil queen. In every way, she looked an Arasi as she lay down on her bed. She had a beautiful face, and she was so happy to see another Tamilian there. So she caught hold of me, she hugged me, and then she said, I'm so happy to meet somebody from Tamil Nadu. When I heard her story, it shook me to the roots. When her husband knew that the doctor told him that she got cancer, it was a curable cancer, he was advised to treat her immediately. He just went and dumped her in one of his relatives' house and disappeared. Her relative's house in Malaysia, and disappeared. So the cancer escalated and she had to be in the hospice. She was shuttled around. The family was having her. So it's a sad story. Please bear with me. Quite emotional. But it drives home a point that even amidst illness, extreme illness, terminal illness, there can be life and hope and wellness, holistically. So coming back to Tamilarsi, she made sure, she had 2 children by then. She made sure that her children were adopted by a Baha'i family. She told me her story. She said, I chose a Baha'i family who had children because after researching, I found that Baha'is are very tolerant and accepting, and love is their theme. So I chose a Baha'i family, and I haven't told, my children still think that they are the real parents. They don't know my identity. And I want to keep it that way, she said. And she also told me very sweetly, I'd like to share with you one last possession I have. I'm getting a bit emotional when I talk of her. And that is she was working in a powder factory. So she had a powder dabba with her. And that she gifted me. And I heard she passed on after coming back to India. So even in her illness, I found Tamilarasi very well. Another case study is from Coimbatore, the cancer center where I worked, where this person was lying on the cot. He had cancer of the spine, it was traveling up. Let us call him Salman. His name was something else. So we used to visit the patients close to their, near their bed and sit. And we had different portions of the wards where we went. So in the general ward, he asked one of my counselors, why is your head, he was referring to me, not visiting me and visiting everybody else? It was not my turn to see him. So anyway, since the cancer had gone to his head, affected his nerves, he started using obscene language, words, etc., etc. But then when I heard, my counselor found it very difficult to talk to him. But when I visited him, he said, I can connect very easily with you. Do come and see me every day. Forget your section allocation of counseling. So we became good friends. And I found that even his obscenity sort of receded. Because when he asked me, why are people not visiting me? I had to tell him, because your language is, the young people are finding it offensive. I'm a little older, so I'm able to take it. He said, I will show you a different Salman. After, to cut a 1 year story short, I got a call from the cancer center saying, there is somebody waiting to see you, ma'am, come. So when I went, Salman was standing. He was on the bed earlier, standing. He said, I heard you were somewhere in this locality near Avanashi Road. You know, I went by auto searching for you, but I couldn't locate you. So I've come to the hospital. He joined us as part of our cancer care team. He would emote, he would cry on and off, but he was very much part of our process till he passed on again. So what I'm giving you these case studies to tell you, to share with you that even amidst a lot of confusion, chaos, uncertainty, holistic wellness is a reality. This has been my experience. Now let me continue with my PPT. Are you able to see it? Yeah. So wellness, according to me, is an experience. It is a feeling. It is an attitude. This is how I look at wellness. Now, why do I look at it like this? Because in Nitya Gurukula, we have we use what is called the holistic model of a human being. This is a model that I got from my very good friend, who's no more, Meena Prashantam from the Christian Counseling Institute, Vellore. She Okay. Now she spoke about, she gave us the basis for the model and we've developed in Nitya Gurukula. Now all of us human beings are made up of 6 dimensions. Physical dimension refers to our body, our biological processes. Psychological dimensions are our emotions, our beliefs, thoughts, memory, knowledge, etc. go for our cognitive. Body language, posture, gestures make up the behavioral dimension. Our communication, interactions, and relationships make up our social. And spiritual is the energy, the power that we please stop the share, whoever, I need your help. my screen. I'm not able to do it. Is it stopped? Can you see me? No?
Yes, ma'am.
Yeah, thanks. Yeah, thanks, Sudha. So coming back, when we have a holistic perspective of ourselves, about others, and about life, I believe wellness happens. The experience of wellness happens whether we are in a pandemic, whether somebody is terminally ill, as my case studies show, whether we are stressed out, etc., etc. Now, how do we develop a holistic perspective? Some of the tools, I mean, if you all are willing, those of you who are willing can do it. I got into Tai Chi many years back. And the reason I got into Tai Chi is I felt talk alone was not enough for me, talking to people alone. We needed, in counseling, I'm talking about, we need to shore up to enhance counseling with some body language corrections and a movement. Again, I'll give you another case study. We got a client who was very much in love with her husband. You know, it was an arranged come love marriage, but her mother-in-law didn't like her for 2, 3 reasons. One was that she felt that the daughter-in-law had taken her only child, her son, away from her. And the other reason was, though she was an ME software engineer, let's call her Rani. His name is something else. For confidentiality purpose, this is an information. Confidentiality purpose, we change the timing, etc. of our clients. Okay. So coming back to Rani, she must have been late 20s, early 30s. She was such a beautiful, educated, had everything going. But because of her mother-in-law, she was staying with her parents. And mother-in-law had 2 more grouses. They didn't give them her son the car that her son deserved. They gave a simple, ordinary car as dowry. And the other complaint against her was that she didn't talk. The mother-in-law would call her names, abuse her, and Rani kept quiet. So she wondered whether something was mentally wrong because Rani did not react. So she sent her to her parents' house and said, go and get the certificates and come back. Your post-graduation certificates, etc., etc. So when Rani came for counseling, we started with, she couldn't talk to us, only tears flowed. Her mother explained everything that happened. And she got all the more, she got all the more upset when the mother was narrating. So connecting with Rani through body language shifts. So we have worked out a package using Tai Chi and yoga. I used to be a yoga teacher. Now I don't. I'm an instructor for Tai Chi. I taught school children many years back. So I practice both yoga and Tai Chi. So we've developed some packages for enhancing the body language, the voice, etc. With practice, Rani learned to express herself to her mother-in-law, first with body language and then slowly with her voice. Today, then I get a message, and she practiced Tai Chi very religiously, very regularly. She traveled about 40 minutes every day to come and practice Tai Chi. By bus, she would come early morning, come to Nitya Gurukula, the institute, practice and go back. So then she joined her mother-in-law and her husband in their home. And I got a message. I'm sure she's well wherever she is now. Okay. I'm sharing this case studies to tell you that holistic wellness is not a concept only. It is not a theory. It is a possibility. It is a very high probability. So now coming to the last slide. How am I so sure that it is? I told you one of our members, families, our institute, family members got COVID. And within a couple of days, in fact, only one tested positive, the other 3 didn't. I'm not making any claims here. The other 3 tested negative. They are regular practitioners of Tai Chi for the last so many years. I think close to 7, 8 years. So the probability of wellness in the pandemic is very high with these practices. I will begin with breath work, which Sudha will demonstrate, and if you're interested, guide you through after I finish my address. She learned it, she does a combination from, and she got this, she's developed it. She took training from a vascular surgeon in the US who talks about breath work. She will give you the name, etc. Another tip for holistic wellness is movement with boundaries. Now, what do I mean when I say movement with boundaries? In our culture, our Indian culture, ethos, I would say, our ethics, we are very close-knit tribal group, as my Western colleagues call us. What do they mean by that? We are not independent. We are with each other, for each other, and we are interdependent. So even social distancing is quite a trial for us. But I find we have to take it to our psychological and cognitive distancing also, especially in families. I'm not asking us to separate from families and be detached from one another, but learn to look at each other from a distance. In Tai Chi, we have a form which includes stepping in and stepping out. In stepping in, we become closer. Stepping out, we look at from a distance. In Rani's example, she and her husband learned to step in, look at their common goals, and step back or step out when it came to looking at her mother-in-law and his mother. Let's call her husband Anand. He found it very difficult to look at his mother objectively because she had pulled the whole family through a very difficult financial setup. But in this case, his love for his wife literally forced him to look at her objectively. So it is important cognitively to learn to step in and step out. Now, how do we do it? So I come to what we call contractual being and functioning, personally, professionally, and organizationally. Now, in transactional analysis, we give a lot of emphasis to contracts and contracting. We all know contracts is a mutual agreement between 2 or more persons. We all know the administrative contract, like today, the time was fixed, everything was done beautifully. On time, we started 5 o'clock. We've been given 1 hour. The arrangements are perfect for this webinar, etc. That's the administrative contract. The professional's contract are the skills we bring into our profession, the attitude we bring in. The trick is in the psychological contract. Many times that is never focused on. And like the famous psychologist Csikszentmihalyi, the one who developed the concept of flow, he says, where the attention is, the focus goes and the energy goes. Where the attention is, the focus goes and the energy goes. So when looking at our psychological aspect of our contract is absolutely essential, especially in close relationships especially during the pandemic, when we are thrown together in a confined space, limited space, we have to coexist. Remembering our roles and boundaries is absolutely essential for me. I cannot take ownership on any relationship. Now, this is something which is challenged continuously by my clients, by trainees, etc. Like today, I counseled a young lawyer. She's not from Coimbatore, she's from another city. She had a breakup with a boyfriend. They had a 4-year relationship and it was very painful for her. So she said she was struggling how to deal with it. And more than the feeling of loss, the feeling of anger because he walked out of the relationship was more. So helping her step back, contractually look at the relationship brought a lot of relief. Otherwise, she was close to having breathing troubles because of the anxiety, piled up anger and anxiety. I'm saying this to say it is very, very extremely important that we learn to contract in our personal lives, in our professional spaces, and organizational. Is it possible? I think so. It happens with practice, regular practice. Now, there is one idea two ideas I want to leave with you before I complete. One is, excuse me, bear with me when the Guru within. In Nitya Gurukula, all our operations are based on the philosophy, the vision of the Guru within. Now, what do we mean by the Guru within? We have a remover of ignorance inside each one of us. My trainer in my first level in transactional analysis used to tell me, you know, even the beggar on the street in India is wise. So that is what I believe, that all of us have wisdom inside us. We can learn to tap it. And for that, certain practices are necessary. Practices of breathing, etc., etc. And then the other one is a holistic view perspective of self, other, and environment. I dabble a little bit in neurophysiology and neuropsychology, where I found that our brain does not let us automatically think about self and others and the environment. The focus can be on one or the other. With continuous practice is when we learn to bring our focus to self, other, and environment. It is not the tyranny of the or, but the genius of the and that we bring in. And when we have this holistic perspective, a view, a perspective, wellness becomes a given. Okay, I have experienced this. And when there is wellness, there is balance, there is harmony, there is peace, and there is joy. I'm not telling you this, Sudha, please stop sharing. Just give me a minute. Please stop sharing. Yeah, thanks. So with this, I conclude my address, and I will take questions after Sudha takes you through the breath work. We plan to give you 3 exercises. This is meant for increasing oxygen flow, which indirectly contributes to our immunity. So I'm going to stop and mute, and Sudha will take on. And after that, we'll open up the floor for questions. Sudha, over to you.
Yes, ma'am. Thank you. So this is Sudha Sundaram, resource from Nitya Gurukula and a certified Tai Chi instructor from Tai Chi for Health Institute and breathwork practitioner. what is this breath workers? It talks about the goal is optimizing your breath. So before proceeding deep inside it, what it does is it helps to reduce our stress and increase our immunity, which is almost an essential for our today's pandemic. So a quick question, two questions for reflection. One is where we breathe from. Are we breathing from nose or mouth? Second question is, are we doing deep, shallow breathing or deep breathing? Because our focus, our goal is to optimize our breathing. So to optimize our breathing, two things we have to be aware of. One is nose breathing through nose and another is deep breathing. So let us practice these two. So when I say nose breathing, because studies shows that 80% of the people are mouth breathers. Most of the time, and particularly when they are sad, anger, sadness, anxiety, and fear. Unconsciously, we open our mouth and breathe, take in a lot of oxygen. Though oxygen is going in, but is it optimal experience? No. Is it productive? No. So let us use nose for breathing and smelling and mouth for talking and eating. So let us practice optimal breathing techniques. So first is 3 techniques as ma'am said. One is massaging. So massaging helps to open up the nasal passage and to increase the blood flow and energy flow and paranasal sinuses. The massage here. So please join with me. Let us practice techniques and then I'll come out with the benefits. So please start with me. First, our hands are safe to take near our face. Gently rub your hands and gently massage. This is where paranasal sinuses are situated. When we gently massage over the eyebrows, below the eyebrows, side of the nose, temple, cheek, just massage gently. Feel the massage, your jaw bones, forehead, pull your ears. Now gently tap with your fingers. Good. Now you are ready to breathe. Just breathe through your nose. Frown your face and breathe. Come on, frown your face and breathe. Experience the amount of oxygen going in. Now, smile, closing our mouth, smile and breathe. Experience the amount of oxygen going in. So when smiling, more oxygen goes in because door passage is getting opened when we smile. So let us smile while breathing. And another is, now we are going to connect nose to belly breathing. That is second point, which is deep breathing. So when we breathe, inhale and exhale. These are the 2 things we are going to do. When you inhale, imagine air going in through your nostrils and expand your abdomen, lower abdomen. Like a balloon, expand your lower abdomen. When you exhale, contract your lower abdomen. Tight your lower abdomen. Pull your belly button in. So these are the 2 things. When inhaling, expand your lower abdomen and exhaling, contract your lower abdomen. So let us experience this breathing. Let our breathing be gentle, slow and smooth breathing. So just place your palm below your belly button in lower abdomen. So now gentle inhalation and exhalation with a smile. Close your mouth. Inhale. Expand lower abdomen. Please sit upright posture. Relax your muscles. Inhale. Expand your lower abdomen. Exhale. Contract your lower abdomen. So let us do it for 2 more counts. Inhale. Take your focus to your breath. Your lower abdomen expanding. And while exhaling, contract. Inhale. Exhale. So this is the breathing, nose to belly, connecting nose to belly. Next breathing is humming breathing. Because as I said, when we breathe, when we inhale oxygen, it carries nitric oxide produced in the paranasal sinuses. Nitric oxide, it gives 3 benefits. It expands the blood vessels, it increases your immunity, and enhance the memory function. So these are the benefits we get from nitric oxide. Where we get nitric oxide? It gets produced in our body and majority produced here in paranasal. Then we are massaging and rubbing. When we do humming breathing, the production of nitric oxide is 3 times more. So let us practice humming breathing. Inhale. Again, expand your lower abdomen and inhale. While exhaling, like a bee, do the sound from your nose. Close your mouth, clench your teeth and hum. So please join with me. Inhale. Exhale by humming. Prolonged exhalation to your comfort zone. Inhale. Exhale. And last time, inhale. Exhale. This humming helps to produce hormone melatonin, which also helps to enhance our sleeping pattern. Last, let us settle. Relaxation breathing. Open the palm. Inhale. Bring your hands as if you are lifting the basket. And exhale. Gently push it down. 2 more counts, please. Inhale. Exhale. Inhale. And exhale. Thank you for practicing along with me. So please, daily, it will take 5 to 8 minutes. It helps to improve our immunity and reduce our stress. So when our breath pattern is normalized, so you'll have that optimal experience. So enjoy breathing, happy breathing. Thank you.
Thank you, Sudha. So we come to the question time. Please.
Yeah, Dr. Veena, are you there? Dr. Veena?
Yes. Thank you so much, Shashi ma'am, for this wonderful session. Hope you remember me. We met in the Madras University Platinum Jubilee Conference, and I learned TA 101 from you, ma'am. So, and I was telling to Suresh sir, it would be a wonderful session, ma'am. The way ma'am teaches is so nice, and thanks for
Thank
getting the live examples and live cases and enlightening us with your teachings. And now is the forum is open for question and answers. And participants, whoever have any questions, you can either unmute yourself or put in the chat box.
Thank you, Veena. Good meeting you online.
Yes, ma'am. Nice meeting you. And thank you, Sudha ma'am, also for that wonderful exercise. Everyone felt so rejuvenated and refreshed. Thank you for that. And yes, participants, any questions? Ha. There is one question, ma'am. Is there any condition for breathing exercise? When is the best time to do breathing exercise? This question is from Vishal Mukut. So I think Sudha ma'am.
Yeah.
Ma'am, would you like to answer, ma'am? Or-
No, please go ahead, Sudha,
Yes,
please.
yes. So, any time, your convenient time, but keep one fixed time. See that your abdomen is not full, that is not immediately after your breakfast, lunch, or dinner. 2 hours after your food or before the food. But keep on specific timing, either morning or evening.
And I will just explain why a specific timing. Because our nervous system and our entire body will get used to, the changes at that particular time. This is what is advised by Dr. Lamb, and I think it's a very useful suggestion. Having said that, sometimes if we skip in the morning, it's okay to practice before lunch or dinner when the stomach is relatively empty. Yeah, there is a question. Can you explain about organizational contract, ma'am? Yeah. I will talk from the point of view of a student and from the point of view of a faculty. And I'll also use a diagram to talk. I will draw it out on the board. Is there a possibility to, I'm not used to WebEx. Sudha, please stop sharing. Is there a possibility for a board in this WebEx package? Can we have a board?
Suresh sir.
That I'll check now.
No, it's not necessary, sir. I will, what I'll do is I'll draw it on my notepad and hold it up. I think all of you will be able to see this. Yes?
I think yes. Yes.
Okay. So this is a triangle, equilateral triangle, and this will be the organization. Okay. I'll make it an O. There is self, and there is either the student or the faculty. So again, I'm holding it up. Yeah. So there is the organization on top, known as the higher power, self, and either the student or the faculty. Now this in TA, we call the three-cornered contract.
Ma'am, whiteboard option is there. If you want, you can use.
Yeah. Okay. Sudha, can you do it? Who drew this?
Dr. Suresh is doing.
Can you please write out three-cornered contracts? If it's possible, otherwise I'll use this itself. Don't worry. Three-cornered contract. So we can stop sharing, Sudha, please. Yeah, stop. So the contract, for example, as a CEO, I'll talk about my contract to the organization. As a CEO, I do not identify with the organization. Nitya Gurukula is more than me and beyond me. Can we stop the share, please? So I can see people. Yeah. So the organization is on top. What I mean is, when the organization is on top, for me as a CEO, the vision, the mission, and objectives of the organization influence my decision making, which again influences my daily activity. Now, when I relate to my clients, my contract with them is different. So there are 3 parties involved or more parties involved in a organizational contract. I think I've answered. Yeah. Thank you, Sudha.
Thank you so much, ma'am. There is another question like holistic wellness is often affected when we are in moral dilemma in specific situations. How to handle this?
Holistic.
Wellness is often affected when we are in moral dilemma
Yeah.
in specific situations. So, how to handle this, ma'am?
Yeah, it's a very good question, because moral dilemmas take us to the zone of ethics. When there is a conflict, there is a ethical question coming out. So my first advice is, let us not focus on who is right. Am I right or the other right? Am I right or my parents or who's right? But focus on what is the goal. A contract involves both a goal and the process to achieve the goal. So we need to focus on the goal, and it needs to be simple, achievable goals that we set ourselves. We cannot set, like, for example, a realistic goal like I need to go to the moon tomorrow. We can't. Goal and process make up a contract. Okay. Yeah.
Yes, thank you, ma'am. The next question is from Kanishka. Hi, ma'am. I am a student of psychology. I would like to know, how do you cope with the emotions and stress while dealing with cases wherein you can relate with the case?
Yeah. Good question again. So what I do is, I will let myself feel with all my clients, experience the feeling. And this is where in psychology, what is called a parallel process. Sudha, please type it out. A parallel process happens. The emotions of the helper and the helpee are parallel. They go in sync. Now that is used to help the client or the trainee contractually. And that is where the psychological contracting and boundaries happen. We cannot and should not afford to lose ourselves. So emotional regulation is necessary. In counseling, holistically, I do not believe or think or train people to numb or mask their emotions. We use our emotional experience to help our clients and trainees name emotions and learn to regulate and handle them. Yeah. I think that's all the questions for now.
Yes, ma'am. So, any other questions from the participants? You can unmute yourself and ask, or you can put in the chat box.
Hi, Girija.
the chat box is flooded with the feedback and thanking for today's speaker, both Sashi ma'am as well as Sudha ma'am. Thank you so much, ma'am. And now is the time for us to express our gratitude. So I invite our Dr. Suresh Kumar sir to please place vote of thanks for today's
Salim sir. Salim sir.
Salim sir. Yes, sir. Dr. Salim sir.
Thank you, Dr. Veena ma'am. It was a very nice, wonderful session we had about holistic well-being by our resource person, Mrs. Sashi Chandra ma'am, the CEO of Nitya Gurukula. Ma'am, you really explained very well in, I think I can say it is the fourth dimension aspect of the holistic well-being, I can say, not in the 3 dimension. So we learned a lot about the holistic model of a human being, like self, others, and birth infinity. So it gives the different aspect and a different thinking perspective about the well-being. And you very well clearly explained about the like optimum, with the realistic optimum, like goal and process should be the realistic, and that goal the contract should be. Then only we can achieve. So it is a very clear-cut contract agreement between goal and the process. I mean successful goal and successful process. So we learned a lot inputs and we learned a lot, ma'am. So kindly accepted our gratitude on behalf of American College Madurai and MS Chellamuthi Institute Madurai and Red Pond Educational Psychological Research Center Madurai and Yellow Pond Counseling Center Madurai and Madras School of Social Work Chennai. Once again, thank you very much, ma'am, and thank you, Sudha ma'am, and thank you all the participants. Thank you, one and all.
Thank you, sir. Thank you.